IBS and gut bacteria. IBS is incredibly common, affecting around 11% of the Western population. It can severely impact quality of life and ability to live a normal life. What causes IBS is not well understood, though research is being done. There are a few types of IBS. First type being IBS-C, IBS with constipation, meaning that it causes you to be constipated. IBS-D is IBS with diarrhea, and IBS-M is IBS with mixed symptoms, meaning that when you have your onslaughts, you tend to have, bouts of diarrhea, then constipation, then diarrhea, then constipation, or sometimes it's even mixed, where it's very watery, but you have a very hard stool in the middle of it. While it's widely accepted that IBS is a culmination of multiple factors, it's assumed that gut bacteria may be one of those important factors. There have been many studies looking at the microbiotic presence during IBS, but there are no common changes to the bacteria so far. This could be because of the identification techniques used, normal differences in strains between people, and sample sizes. Most studies focus on fecal microbiota, as it's easy to acquire, but the colonic mucosal microbiota may be just as important, even if it requires slightly invasive means to gather. Very few studies have looked at both regions in large numbers of people, so this study is trying to change that. They gathered samples from adults between the ages of 18 and 65 that were diagnosed at Sahlgrenska University Hospital in Gothenburg, Sweden. Samples from patients who used probiotics or antibiotics during the study period, who had been diagnosed with other issues that could cause this, or had severe psychiatric disease as the source of the issue, were excluded. There was also a healthy control group gathered, as would be necessary. These samples were collected from 195 subjects. Most subjects had 2 samples gathered in the first set. The first set was called the exploratory set, and the second set was the validation set. The exploratory set had 149 people in it, 110 with irritable bowel syndromes, and 39 healthy. 232 fecal samples were collected, and 59 intestinal biopsy mucosal samples were collected. The validation set had 46 subjects, 29 with IBS and 17 healthy, and they collected one sample per subject. There was no difference between the IBS or healthy patients in regards to sex, age, BMI, or clinical parameters after they corrected for test multiplicity. The microbiota from the fecal and the colon samples were paired, and they were closely related. They didn't seem to have any differences between them. There was no need to study in the second set. There was no need to go in and get biopsies done. The exploratory set found no difference in the abundance or variability of the microbiota. But as they studied, they found that the presence of methanobactyls correlated with what type of IBS the patient suffered from, meaning different amounts of them correlated to different types. Healthy people had much less methane coming out in their breath than even IBS patients with only mild symptoms. This study used I believe, lasso methods to get them with a machine learning approach to show that IBS severity is associated with specific fecal microbiota signatures that can be detected in intestinal mucus as well. These signatures are also tied with microbial richness, the exhaled methane and the presence of methanobacterials, and the stool's consistency and transit time.